It is time to check in with infectious disease specialist Dr. Zain Chagla. Thanks for joining us. Happy Friday.
Happy Friday.
Or maybe not. Sorry about the Raptors. I know you're a huge fan.
I know there's better years ahead. Let's just say that.
Okay, we'll leave it at that. And hopefully better years on your front as well with the pandemic. Now, Dr. Anthony Fauci is saying the pandemic is over. What's your thoughts?
I would say it's leaving the emergency phase was what his guidance was. And I think that's, a reflection of the United States, not necessarily here where hospitalizations are dropping. A lot of the population has either been vaccinated or infected, and that's obviously giving some protection against severe disease. And he was still very clear to say, look, a new variant may change things, and this pandemic is constantly evolving. But where they are sitting right now is really a period of calm and a period where, again, we've been talking about making risk-based decisions rather than kind of emergency measures in that context.
But having said that, Hamilton Health Sciences is saying that it's the worst capacity issues since the beginning of the pandemic. A lot of staff isolating, so it's really whipping around.
Yeah, I mean, look, there's a lot going on. We can't discount what taking out even 5% of the workforce looks like at any given time. Is this, is mild in those individuals, but not working is definitely having concerns. There is a lot of catch-up care from all the closures and people from lost medical care during COVID, which unfortunately is coming to the surface, and acuity for patients is higher than it's been before. And it is creating challenges. We can't go back to the way it was. We can't put people in hallways. We can't pack people into rooms. There are changes that have happened during COVID-19 that really have to be with us for the long term. Unfortunately, with aging medical infrastructure, with a healthcare human resource workforce that's burnt out, there's only so much we can get out of our medical system these days, and people do need to be cognizant of that.
Right. And there's new data out saying that a third of us have had COVID-19. Is there a possibility of, if not herd immunity, herd resistance?
Yeah, I mean, look, this is a blood donor study from Canadian Blood Services where 1/3 had antibodies that would only be produced by people that had COVID-19, not necessarily vaccinated. It's likely the number is actually bigger than that. This study, is blood donors, and blood donors tend to be more health-seeking, tend to be more cautious, tend to be more health positive, and so those communities that aren't blood donors may be underrepresented. And I think we realize, with things like the wastewater data, with serial testing and healthcare workers, the number is probably closer to 45 to 50%, which is really remarkable considering it was relatively small before Omicron hit, and really does reflect how infectious this virus was.
Before we go, there's a non-COVID question I wanted to ask you, because there was a disturbing story of hepatitis, severe hepatitis, cropping up in Canadian children of unknown origin. What do you know about that? And is this concerning? And are there other things that keep infectious disease specialists like yourself up at night?
Yeah, so this is, obviously a little concern. This has been noticed around the world, predominantly in the UK, through Western Europe. Israel, now Canada, and the United States are reporting possible cases. These are children that are otherwise healthy that are developing severe hepatitis. It is rare. There's less than 200 children that have been documented. A few of them have required liver transplant for how bad it's been. Many have recovered normally, though, with steroids and supportive management. But it's unclear what the etiology is. There is some data from the United Kingdom and the United States talking about an adenovirus, which is a cold and cough and gastrointestinal virus that kids are normally exposed to, adults are normally exposed to. It can occasionally cause hepatitis, but not really to this degree. And so there's a lot of questions of what is the other piece. Is it COVID-19? Is it, immunity? Is there some other cofactor we're not discovering? And so, that's really what international scientists and epidemiologists are trying to put together so that we have a better sense of what's going on here.
Okay, well, thanks for that. No, we'll chat again next week. We have weekend weather coming up. Oh, we have sports coming up, too. The Raptors lost, by the way. I don't know if you... Sorry. Thank you, Dr. Chagla.